Hello, this is Dr. Praveen Ramachandra. I'm senior endocrinologist working in Diaplus Endocrinology Clinic, Yelahanka, Bangalore, India. Please watch this video.
Welcome to This Explainer. Today, we're demystifying a journey that blends incredible medical science with profound human hope. In vitro fertilization, or IVF as we all know it. If you've ever felt completely overwhelmed by the clinical jargon or the frankly complex timelines of fertility treatments, well, you're in exactly the right place. Today's patient education is brought to us by Dr. Praveen Ramachandra. He is a senior endocrinologist over at the Diaplus Endocrinology Clinic in Yelahanka, Bangalore, India. We're going to walk through his comprehensive, step-by-step patient guide to IVF. We'll explore exactly what happens, when it happens, and why it happens, basically translating this medical roadmap into clear, bite-sized steps.
Okay, let's dive into this. Here's our agenda for today. We'll start with preparation and screening, then move on to stimulating the ovaries, retrieving eggs and sperm, fertilization and ICSI, the embryo transfer, and finally, testing and alternative cycles.
All right, Section 1, Preparation and Essential Screening. Before a single lab test is even run, this guide acknowledges something absolutely crucial: the emotional weight of infertility. The source is super explicit about the frustrations and disappointments couples face. And because of that intense stress, it is highly recommended that patients sit down with a counselor first. It's just a great reminder that mental and emotional readiness is just as important as the physical side of things. Once you're mentally prepared, you sign the necessary consent forms, and we're officially on our way.
Now, what's really interesting about this step is the strict baseline screening required for both partners to ensure a totally safe cycle. For the wife, the checklist includes a complete hemogram, blood sugar, urea, SGPT, creatinine, blood group, TSH, and a urine test. Quite the list, right? For the husband, a sperm test within the last 6 months is required. But notice the overlap here. Both partners absolutely must be screened for hepatitis B, hepatitis C, and HIV. Confirming all these tests are up to date with your doctor is the definitive starting line of your treatment.
Moving right along to Section 2, stimulating the ovaries. So the whole goal here is to use medications to stimulate the ovaries to produce multiple eggs instead of just the usual one. This is a real game changer because it significantly increases the chances of pregnancy. This specific timeline we're looking at is known as the antagonist protocol. On the second day of your period, you visit the clinic, no appointment needed. After a quick sonography, you start a 9 to 10-day series of injections. And get this, they need to be taken at practically the same time every single day. To make life a little easier, the nurses actually teach patients or their family members how to administer these right at home. Fast forward 5 days, you have your first vaginal ultrasound to measure the follicles, letting doctors tweak dosages if they need to. Then another ultrasound follows 3 or 4 days later, and that brings us to the absolutely crucial trigger injection. After all that careful monitoring, when the ultrasounds show those eggs are finally ready, you get an injection of HCG or a similar hormone. Think of this as a precise biological countdown. It literally triggers the final maturation of the eggs, setting the exact schedule for the next massive step in the process. Which takes us right into Section 3, retrieving eggs and sperm.
Exactly 35 to 36 hours after that trigger injection, boom, the active phase begins. This is the egg collection procedure, officially called ovum pickup, or OPU. Now, if the idea of surgery makes you nervous, these facts should definitely offer some reassurance. It is a super quick procedure, taking only 10 to 20 minutes. It's done with transvaginal sonography under general anesthesia so you won't feel a thing. And the best part? You can usually head home just 3 to 4 hours later. The guide does frankly mention that some mild vaginal bleeding and pain are pretty common afterwards, but that usually settles in a day or two, and most importantly, it does not affect your chances of pregnancy.
Now, on that exact same day, the husband has a job to do. He needs to provide a fresh semen sample. But the parameters here are highly specific. The sample is best produced by masturbation, and absolutely no lubricants should be used because they can actually ruin fertilization. There's also a strict timing rule. You can keep having sex during the treatment cycle, but you should avoid ejaculation for 2 days right before the egg collection. But, and here's the catch, going more than 4 or 5 days without ejaculating can actually reduce sperm quality. It's a delicate balance. And just to be safe, because let's face it, producing a sample on demand is stressful, a frozen backup sample is usually taken earlier in the process.
All right, Section 4, Fertilization and ICSI explained.
So while standard IVF is an option, the source details a really remarkable procedure called ICSI, intracytoplasmic sperm injection. Imagine the sheer precision required here. We're talking about an embryologist using a highly specialized microscope and a micromanipulator to collect a single individual sperm. Then, using these incredibly fine glass needles, they inject that one sperm directly into the center of a mature egg. It's like threading a microscopic needle. This meticulous process is repeated for every mature egg they've collected. Over the next few days, the embryologist watches them like a hawk for fertilization and growth.
Next up, Section 5, the embryo transfer process. Usually about 3 or 5 days after the egg collection, 1 or 2 of those successfully grown embryos are transferred right back into the uterus. And honestly, this procedure is wonderfully simple. It takes just a few minutes, requires absolutely zero medication or anesthesia, and is done under sonography using a very fine, soft plastic tube. You literally just need a moderately full bladder. And perhaps the most magical part of the whole shebang, you actually get to see your embryos right before they're transferred. Post-transfer, there is absolutely no need for bed rest. You can go straight home or back to work and just resume your normal life, though, maybe skip the heavy lifting for a bit. But here is an absolutely critical medical directive from the guide: luteal support. You'll be prescribed vaginal capsules or injections to support your cycle. Now, if you experience any spotting or bleeding, definitely contact the hospital. But whatever you do not stop taking these medications without talking to your doctor first. That is literally crucial.
Finally, we arrive at Section 6, testing and alternative cycles.
The moment of truth arrives 14 to 15 days after the transfer with a blood pregnancy test. If it's positive, huge congratulations! You'll schedule an ultrasound about 7 to 10 days later to check on things. If the test is negative, well, your next steps depend entirely on whether you have additional high-quality embryos stored away safely. And that brings us to the strategy of freezing embryos. Sometimes the doctor will recommend an elective or all freeze. Basically, this means they won't do a fresh transfer in your current cycle. Why? Well, sometimes your body's response to those stimulation drugs makes the current cycle a bit unsafe, or it might just reduce the chances of a successful pregnancy. By freezing all the embryos, doctors turn a potential setback into a massive strategic advantage. They just save the embryos for a future cycle when your body is perfectly primed and ready. And this brilliantly illustrates the difference in those future cycles. In a frozen embryo transfer cycle, the protocol is a breeze. The wife takes tablets, things like estradiol valerate and progesterone, to perfectly develop the uterine lining, which is monitored by ultrasound. The husband, he isn't needed at all for this part. Now compare that to a donor-recipient cycle. In that scenario, the donor is the one taking the complex stimulation drugs we talked about earlier. The recipient wife is prepped just like in the frozen cycle, but here, the recipient's husband is needed on the day of the donor's egg collection to provide that fresh semen sample. So we've covered a tremendous amount of ground today, right? From those very first blood tests to the microscopic miracle of ICSI, all the way to the strategic planning of frozen transfers. The IVF process is undeniably complex. It demands a lot of emotional resilience and really precise clinical timing. But armed with Dr. Ramachandra's roadmap, you don't have to view this process as some intimidating mystery anymore. By understanding the what, the when, and the why of everything we've looked at today, are you ready to step forward and navigate your own IVF journey with clarity and confidence?